I'm Dr. Geeta Kadaiprath and I'm a breast surgeon at Max Hospital. So my message in terms of breast cancer awareness is that in our country the problem is more about detecting breast cancer early. If you realize that in our country about 60 to 70% of breast cancers still come in advanced stages. So I primarily think that people are not very body aware, not very breast aware. So the challenge is to make people aware of their own bodies. We probably are brought up in a situation where girls are taught not to touch their bodies, and we are loath to examine ourselves. So the challenge lies in teaching women to be breast aware, so that anything that happens in that background tends to be picked up early, and you report to the doctor earlier than later. And if any woman were to find a lump or something unusual in the breast which was not there before, they should reach a doctor, preferably a surgeon. Usually what happens is patients land up going to their gynecologists because they have a relationship with them in terms of having had their children with them. So they have that level of confidence and they relate to them, so they would want to go back to them. But sometimes these things can be missed at that point. And it is a good idea to approach a surgeon who probably sees these things more often than not, and make sure that it is tested and checked and taken to its natural conclusion before deciding whether it is something to be worried about or not. So the idea of being breast aware is that you are able to pick up things early. So what could be a stage 4 could actually be picked up when it is stage 2. And if it is stage 3, you could actually reduce it to a stage 1 if you were more aware than otherwise. And how it affects the outcome is that if you were to pick up things early, the treatment is much lesser and the outcomes are great. So early detection is the key to actually beating breast cancer. And the worrying thing about our country is that we're seeing breast cancer in very early ages, in the 20s and the 30s. So that is the age group that worries me. So it is a good idea to learn breast self-examination and examine yourself starting age 20. And the best time to do a breast self-examination is a week after your periods are over, if you're premenopausal. And if you're postmenopausal, it is a good idea to have that date coincide with the date of your marriage anniversary or your birthday. So for me, early detection is the key to dealing with our breast cancer scenario, because screening is not a viable option in our country. And probably the West is also moving away from the advantages of screening. So I think we should stick to just try and detect breast cancer early than later.